Everyone, this is Dr. Clark from the Center for Weight Loss Success, and tonight, Losing Weight USA, we're going to talk about something that's been, discussed over the last couple of years more and more commonly, and we see this as a very common problem. That's gluten sensitivity. So we'll talk a little bit about what is gluten and what does it mean, sensitivity, what are the symptoms that come around, and okay, what do you do about it too? All right, here's the official welcome. Welcome, Losing Weight USA. This is real-time answers to your weight loss questions, a little bit of the latest updates and research, as well as a little bit of expert advice. Gives you direct access not only to me, but you should be receiving the health tips and recipes via the membership portal. Each webinar is going to last about 30 minutes or so. If you have questions, just type them into the chat box as we go along. We'll get to them at the end as time permits, and as you know, we'll make time permit. So if you think of things once we're all done, just give us a yell here at the Center for Weight Loss Success. The email is success@cfws.com. Phone number 757-873-1880. All right, so let me flip these slides over. Let me try that again. Here we go. Hopefully. Here we go. All right, so I throw this little cartoon to start us all up here, and it's a doctor talking to his overweight patient and saying, the high-carb diet I put you on 20 years ago gave you diabetes, high blood pressure, and heart disease. Oops. Yeah, we sometimes think about the things that we are telling you are healthy 20 years ago don't turn out quite so well. And as we see here in this little graph, and it's just a little reminder of me to talk about the incidence of diabetes. The incidence of diabetes has increased dramatically over the last 25 years or so. From this is a graph showing from the early 80s, where the number of millions of people in the U.S. that had diabetes, that was less than 6 million, that now, and this was from 2011, so we're talking about old data now, the numbers keep just going up. Now it's over 20 million. It's closing in somewhere around 21 million or so Americans have diabetes. And that sharp incline basically corresponded to when we were telling people that fat was bad. You should all be on a low-fat diet. When we went on a low-fat diet, basically that meant high carbohydrate. And so subsequently, all these problems then started arising. All right, and gluten is in a lot of these carbohydrates. So we hear about gluten allergies, gluten sensitivity all the time. So we're going to discuss some of these things and what do they actually mean. Well, the word gluten comes from Latin, and its meaning is glue. Well, okay, that makes sense there. Okay, but it's a large water-soluble protein. So gluten actually is a protein, okay, and it's found in many grains. Wheat is probably the biggest one that it's found in, but it's found in many grains. And what it does, it tends to give elasticity to dough. So it's much easier to shape it, to get it to rise, and so it gives it, it's making that pizza crust where it can stretch it, and it gives the elasticity to the dough. So it helps it rise then. So if you make this dough and you're waiting for it to rise, that's the elasticity, and it tends to help it keep its shape then. So it is a protein that is in grain. Okay. Now, gluten-related disorders, it's really a broad umbrella. It's an umbrella term that any disease triggered by gluten. And it does include true celiac disease, which is one of the things we hear people, because it's one of the most debilitating disease process from gluten, but it includes celiac disease, but it also includes then gluten sensitivity, and also then finally wheat allergy. So all of these are gluten-related disorders. Celiac disease is probably the one that because it's so debilitating and all the GI problems that people think about. But gluten sensitivity is actually much, much more common. It just may not cause quite the debilitating disease. So celiac disease is truly an immune-related disorder. And it means that your immune system is attacking your own tissue, but it's related to this gluten. Okay? So it's attacking, these are gluten that are setting off this immune response that causes all these other problems. Okay? And it affects 1 to 2% of the population. And as time goes on, we're seeing it affecting more and more people. This is true celiac disease. The symptoms often are chronic diarrhea, you get abdominal pain, bloating, malabsorption. The treatment there is a gluten-free diet. It's very straightforward, not easy. Maybe I should say very simple, not easy. Simple and easy are two different things, say it all the time, but basically it's gluten-free diet. There it is, there to treat it. Okay. Unfortunately, gluten shows up in lots and lots of things that you'd never expect it to, and many things that don't actually have to do with eating either. Now, there's also then non-celiac gluten sensitivity. We usually shorten it by calling it just gluten sensitivity. And so this may or may not actually have any intestinal complaints in it. We often think of gluten causing all these intestinal problems, but gluten sensitivity may or may not have any intestinal complaints. But there are multiple symptoms that improve when we take gluten away. So again, the treatment is very similar. It's okay, take the gluten away. Okay. But this is actually much, much more common, and potentially it affects 30 to 40% of the population. And that third thing we mentioned was wheat allergy. Now, wheat allergy is a true anaphylactic reaction. It's like having an anaphylaxis to peanuts or anaphylaxis to bee stings. Really quick onset. It has to be treated very quickly. Basically, it's the EpiPen and that kind of thing. So this is a true wheat allergy. And typically, you'll know that if that occurs. It's the gluten sensitivity that's much more difficult. All right, so here's just a little model, if we want to call it, of gluten. Okay. So gluten it's in the lower part of the picture there. The gluten, it's all these little things that come together. It includes water in there, but it also is the gliadin. And it's the gliadin that's really thought to be one of the inciting culprits there. And then there's the glutenin. You put all these three things together and you got gluten. Okay. But again, it is actually a protein. Okay. Then gluten tends to be everywhere. I don't expect you to try to read this slide, but the whole point of this slide is that it's in everything. And it really kind of is all kinds of different grains. Certainly it's in wheat, but it's also in barley, bulgur, like listen about the gram flour, matzo, rye. There's all kinds of different things, but it's mainly wheat that we think about. And then there are a few things that are actually gluten-free, so used for grain. Millet, corn, okay, quinoa, okay, those are like rice. Actually, they are gluten-free. So for those people that are gluten-free, there can be substitutes. Just realize a lot of the substitutes are actually fairly high carb. But there are all kinds of things that contain gluten, from beer to vegetable shortening to hot dogs to all kinds of different things. So I've listed them on there, and if you can get your magnifying glass, I'm not going to talk about all these different things, but there are multiple things that gluten is in. And if you kind of look around, you can find, and most things are often labeled now, hey, they do contain gluten or don't contain gluten, because it is such a common problem. It tends to be everywhere. So gluten sensitivity, and that's what we're really talking about here. So the celiac disease people, they know they have it. The wheat allergy people, they know they have it. It's the gluten sensitivity that affects so many people that many people, and actually probably most people, don't actually know that this could be potentially affecting them and causing them to feel poorly. Now, I mentioned they may or may not have gastrointestinal symptoms. But some of the main symptoms potentially of gluten sensitivity are GI, irritable bowel syndrome. Okay, those are often very similar symptoms there. So those people that have been labeled irritable bowel, you may actually have gluten sensitivity. And the treatment is get rid of the gluten. But that can give you abdominal pain, bloating, diarrhea, constipation, nausea, kind of that gassy, aerophagia, kind of all kinds of gas everywhere, reflux, stomatitis, which is sores all around your mouth ulcers. But then it can actually have some neurologic type of things and some other immunologic type things that don't necessarily affect your gut. Headaches, migraines, kind of that brain fog, fibromyalgia. So if you have, quote, fibromyalgia, you may want to try a gluten-free diet. Now, when I say try a gluten-free diet, you typically have to do it for at least a month to know if it's going to help you, because since this is immunologic, it takes a while for those antibodies to actually then clear the system or so. But Also cause muscle and joint pain, numbness, tingling, eczema, skin rashes, depression, anxiety, anemia, folate deficiency, B vitamin deficiency, there, asthma, runny nose, eating disorders. And then some true neurologic problems from schizophrenia, autism, peripheral neuropathy, ataxia, which means imbalanced gait, ADD, as well as ADHD. So kind of lots of different symptoms are potentially from gluten sensitivity. Now, the diagnosis isn't, well, you can say it's straightforward or not straightforward. Unfortunately, the lab tests aren't so straightforward because the antibody testing will actually miss a lot of people. So it's somewhat of a diagnosis of exclusion, meaning that we remove the gluten, go on a gluten-free diet for at least a month, and then slowly reintroduce things. And if your symptoms return, it's likely due to the gluten. And the treatment and long-term, again, simple, not easy, gluten-free diet. Okay. So those with gluten sensitivity often have that false impression that cutting back is helpful. But they really need to avoid all gluten. Okay. And again, gluten sneaks into all kinds of different things. It may have nothing to do with food sometimes too. So you don't necessarily get a specific nutritional deficiency when you stop consuming wheat. And we talk about this all the time. There's no such thing as carbohydrate deficiency. So often people think, well, I've got to get, have to have grains or you have to have fruit. It's like, no, you don't. So there's no nutritional deficiency that occurs when you get rid of everything that had gluten in it. So especially processed foods there. All right, so I put this sign up here. Again, you have to magnifying glass or put the slide up here, the magnifying glass here to see these things. But there's lots of different signs, and I listed a lot of them kind of in the previous slide, but this again lists them all out again. But there are things that probably neurologically occur that are often blamed on, some neurological disease or some mental disease, and potentially are gluten problems. All right, so gluten intolerance is a little more cartoon, kind of recurring headaches, gastrointestinal problems, dental issues. Again, who would think of dental being that mental fogginess, fibromyalgia, again, chronic fatigue. If you have chronic fatigue, it could be, you have gluten problem and lots of different skin problems. You get gluten grains can actually cause a lot of different skin problems there. All right, so what do we do to test for this? Unfortunately, there aren't any real standards outside of, again, take the gluten away, add it back in, see how you do. So there's no real standards of testing this. They do have some antibody testing. So anti-gliadin, we mentioned earlier on a previous slide that gluten is made up of a glutenin molecule and the gliadin molecule and then water molecules. And it's a protein again. So they can actually test for anti-gliadin antibody. That's IgA and IgG in the blood. So you get a blood test done. Unfortunately, again, it still misses a lot of people. You can also look for this transglutenase antibodies. And glutenase is something that breaks down gluten. Okay? So these muscle proteins from damaged intestinal lining. And so subsequently then, if you have a damage, this works well for testing for celiac disease. But if you don't have true celiac disease, then it's going to miss most of you. It only IDs celiac disease 85% of the time. So it's 15% of the time it misses anyway. And then there's something called endomysium antibodies. And these are also antibodies to intestinal tissue proteins. And this will ID about 90% of celiacs. But again, if you don't have the intestinal problems, it's not going to identify you. There are a couple genetic markers. I'll list them out there at HLA-DQ2, HLA-DQ8. These are genetic markers, and it makes you much more prone to gluten problem by about a. And so subsequently, then that doesn't also necessarily answer the question, but it certainly makes you a very high risk. Very unlikely you're going to be able to get genetic testing for gluten. There are probably places that can get it done. And there's also something that's referred to as a rectal challenge. It sounds great, doesn't it? Yeah, but basically they put gluten up the bottom end and see if you get any reaction. All right. Certainly small intestine biopsy is the classic thing for testing for celiac disease. But again, it's still going to miss a lot of people that have gluten problems. And that's where the problem really is. It's testing for just gluten sensitivity as opposed to celiac. Again, there's no real good standards, and that's part of the problem there. Again, we can measure that anti-gliadin antibody. It's an IgA, and you can get it from the blood. You can actually pass it in your stool as well. Now, when you check the blood, about 12% of people are going to have these antibodies. If you actually look at the stool samples, though, about 30% of people are going to have these antibodies. Again, the gold standard is go gluten-free for a month and then reintroduce. If you get your symptoms back, you got it. You got sensitivity. And you want to say, well, maybe that's not real scientific. There's not something measurable, but you can tell how you feel. Okay? And actually, it's incredibly common. Now, the qualifier I want to put on that is that just because you're eating gluten-free does not necessarily make it low carbohydrate. Again, they'll take a lot of things. Some very high carbohydrate foods are then utilized as kind of gluten-free products. So just from a weight perspective, from a gluten perspective, yeah, it works. But from a weight perspective, if someone's kind of going gluten-free, you actually need to be low carbohydrate. And there are many gluten-free products that actually are very high carbohydrate. You don't necessarily want to substitute one processed food for another processed food just because it's labeled as gluten-free. So again, gluten-free does not correlate with low carb. Now, the core diet that I talk about all the time, core diet, water, good protein sources, meat, seafood, cheese, and egg, and then vegetable salad stuff, that's a gluten-free diet right there. So the core diet that I talk about all the time that everybody should be on, especially post-surgery, is gluten-free. Okay? Just realize that's not the reason you're on it. It's gluten-free because it needs to be very low carb. All right. Questions there. So I kind of sped through some of those things. Next week, we're going to talk a little bit more about wheat itself and all the potential problems we see with wheat. But kind of the gluten sensitivity, gluten problems are incredibly common. And if you go true gluten-free for a month, and I'll tell you, you can do anything for a month. Okay? If you go gluten-free for a month, you may find, gee, I feel so much better. Now, there's a couple of very good books I'll throw out there since I have a couple minutes here, is that Wheat Belly, it's by Dr. William Davis. And there's one called Brain Drain, I believe. Yeah, Brain Drain. It talks about all the neurologic problems that can occur with gluten. And that's by, I think, David Perlmutter. Okay. If you search those names, you'll probably get those popped up, and you can probably get them pretty inexpensively at Amazon or a reader of one kind or another. So anyway, there's a lot of good information out there. It used to, 10 years ago, that wasn't true. You search kind of gluten-free, and you couldn't find anything. And nowadays, you can find all kinds of stuff that's out there. All right. Well, if you think of questions, you know where to find us here at the Center for. Give us a call. Pick up the phone, 873-1880. I almost got our phone number. Or go to send us an email at success@cfws.com. Stop in, get your body comp done. I harp on this all the time too. You want to make sure you're preserving the lean body mass, getting rid of the fatty tissue. You should be receiving the health tips and weekly recipes. Tune in each Tuesday, 6 o'clock for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good evening, everyone. Take care.